Hello everyone, my name is Ethelaine Lomantas. I will present to you my video presentation for my project in Nursing Care Management 114, Care for Older Adults. I'm going to explain to you first the meaning of home care and hospice. Hospice is a home providing care for the sick or terminally ill. There are 5 ways hospice care complements geriatric care management in working with the elderly. First, resource, guide, and advocate. This is perhaps the most important part of hospice care and geriatric management. Your care management can also connect you to your resources that are helpful as you cope not only with the day-to-day care of your loved one, but also with grief support in the community. Your care manager can connect you to those resources as you juggle the responsibilities of caring for your loved ones as well as your own family. Second, to home life assistance. It's important that the quality of life is maintained throughout the process. Attentive home care by nurses, volunteers, and other key staff members is crucial in overall geriatric assessment that can be helpful in diagnosing medical conditions, developing follow-up plans, coordinating management of care, and evaluating long-term care needs. Third, day-to-day duties. A geriatric care manager can also serve as a coordinator of daily care that relates to the elderly patient's needs. This can include anything from scheduling and transporting the client to medical and dental appointments, to facilitating communication with healthcare professionals at a doctor's office or hospital. This may also include setting up services that will help elderly patients follow their doctor's orders and take medication as prescribed. Fourth, support services arrangement. Other chores still must be done around the home. That's why a professional comes in handy to arrange for supported services such as housekeeping, transportation, meal delivery, handyman work, money management, and bill paying assistance. This certainly alleviates the burden on family members and other caregivers who are often juggling their own busy lives and don't have time to attend to these things. Fifth, transitioning from long-term care to hospice. Having a trusted liaison in place to make the transition from a standard geriatric care within the home or assisted living facility to a hospice setting is greatly helpful. Second is to explain the meaning of community-based services. It is designed to help community-dwelling older adults remain safely in their homes and delay or prevent institutionalization. Community-based supports and services provides specific resources for older adults and their caregivers that include wellness programs, nutritional support, educational programs about health and aging, and counseling services for caregivers, as well as general assistance with housing, finances, and home safety. Most commonly samples of services and supports provided by community-based organization is the home-delivered meals. The meals delivered to the home of those who cannot prepare or obtain adequate nutrition. Another example is personal care. Hands-on or queuing to assist individuals with activities of daily living or instrumental activities of daily living, which are more complex than ADL. Third is to explain the meaning of assisted living. Nurses who work in assisted living facilities act as the liaison between resident, family, and physician. Assisted living communities provide a great option for geriatric nursing care by a team of staff that build relationships with families and work closely with seniors to provide peace of mind. Nurses who work in assisted living communities are trained to treat each senior as a whole person. They are keenly aware of the balance between medication and a senior's metabolism, as well as the different interactions that occur as a result, and help guide families through the treatment process. With this relationship in place, nurses are able to work closely with a resident in their home each day and observe even the slightest of changes in diet, routine, and behavior. Fourth is to explain the meaning of special care units. It is an inpatient unit within a healthcare facility that is custom designed, staffed, and equipped to care for people with specific health conditions. They are usually in a physical separate space from other patient populations. Common samples are dementia, Alzheimer's disease, and the like. Dementia is an overall term used to describe symptoms that impact memory, performance of daily activities, and communication abilities. Alzheimer's disease is the most common type of dementia. Special care units are especially designed for patients with dementia, implying resident security and safety through locking systems, signposts, and communal living areas. The staff is especially trained to deal with behavioral and psychological symptoms of dementia, a heterogeneous collection of behaviors and non-cognitive symptoms such as psychosis, mood disturbances, personality changes, aggression, pacing, altered sexual behavior, changed sleeping pattern that occurring in the course of dementia. The general purpose of special care units is non-drug treatment of dementia symptoms. That is to reduce the behavioral and psychological problems associated with dementia. Fifth, to explain the meaning of geriatric unit. It is a part of the general hospital. It is comprising wards in a general hospital reserved exclusively for elderly patients, all of whom are undergoing investigation or active treatment and rehabilitation, so that in due course they may be discharged from such wards either to their own homes or, after classification, to other appropriate accommodation. The functions of a geriatric unit is to accept new geriatric patients, whether short-term or long-term, and selected patients transferred from other wards. It's also to provide facilities for the investigation and treatment of geriatric patients. It is to provide observation wards for the primary investigation and medical treatment of all elderly psychiatric patients, except those obviously needing admission to a mental hospital. It is to afford earlier rehabilitation of the elderly by more adequate and prolonged use of physiotherapy. It is to discharge all rehabilitated patients from its wards and to resettle them where necessary in resident homes. It is to arrange the prompt transfer to long-stay annexes of all really irremediable patients. That's all. Thank you.